Knock knock. Gonna wash my hands. Good morning, Brianna. Good morning.
Good
How are
morning.
you?
I'm okay,
Uh,
thank you.
that's good. My name is Camilo Gilabert. I'm the treating physiotherapy today.
Mm-hmm.
How are you feeling?
I'm good,
That's
thank
great,
you.
Brianna. So, do you mind if I have a seat here? Thank you. Yeah, Brianna. So, as I told you, I'm the physiotherapy today. So I can know that I'm with the right patient. Would you mind telling me your full name and date of birth, please, and
Um,
age?
my name is Brianna Smith. I am 65 years of age
All right.
and I was born on the 12th of June.
Cool. Thank you so much for sharing that with me. As you can see here, this is an exam situation. Will be my stressors exam and why, and they will be assessing me. Is that all right for you?
Mm-hmm.
Cool. I got from your files that you had a stroke back in 2017 or so. That was like 7 years
So,
ago. Have you been in
correct.
physio during that time?
Yes, I had physio
All right.
and I've seen an OT as well.
And so I know that you already know how a physio session looks like, but just to refresh your memory, it's gonna be split. My session today is gonna be split in three parts. It's gonna take roughly 15 minutes. All right. The
Yeah.
first part is gonna be me asking you a lot of questions just to get to know you better. Second part, hands-on assessment. We will be planning some goals together, and then we will doing some exercises. How does it sound to you?
Yeah,
Sounds
very
good.
good. Yeah, that's why
That's
I'm here.
great. So as I was telling you, Brianna, I know I got just not much information from your notes, but I know you had a stroke back in 2017. You were at the hospital. Then you spent some time in the neuro rehab as hospital as well, and then you were discharged home. You kept doing some exercises, some physio,
Physio,
but
OT.
yeah, that stopped it probably. So
Mm.
would you mind telling me a little bit more about it? What happened back in the days? What was your diagnosis? You remember that sort of stuff?
No, I only know that my left arm is that's still a bit weak and I
Okay.
can't really properly,
All right.
lift it. That's a bit of weakness. So they've done a good job there in hospital. I had slur
Slur
speech.
speech.
Yeah. And then my husband said something is not right,
Okay.
So and
You went to the
so in
hospital.
hospital, yeah. And then
You're
I had a right. They said that something was wrong with my right side of my brain. That I had a stroke
that controls
there.
the left part of your body. Yeah.
Yeah. I had a stroke there, but I can't remember which part of the brain it actually
All right.
was.
All right.
Right?
That's okay.
My understanding is there's different parts where you
Yeah,
can
there's
have a.
different lobes called like divisions of the brain
Mm,
that controls different functions, but basically the right side of your brain controls the left side of the body. It is closer.
oh,
All
okay.
right, so
Yeah.
that's why any injury in the right side of your brain will affect, or you will be able to see it on the
Yeah.
left side of your body.
And
All
my
right,
arm was more, I felt it more in my arm than in my
for
leg
sure.
actually.
So when you were discharged of the hospital and you went back home, how was your level of function by then? Meaning, what things were you able to do? What?
So she was pretty good, she got me back to walking,
All right, the physio. All
so
right,
yeah, she got me back to walking and the OT did, some stuff, for my
all
hands,
right,
so that I can hold cutlery and all that kind of
sure.
stuff.
All right,
And right now, what it is right now, I'm pretty good, in getting in and out of bed. I don't need assistance anymore.
all right. But
Right?
do you remember how were you as soon as you got discharged home? I mean, when you were at home the first day after hospital, was there any info about it? Or maybe you
Can't remember.
can't remember. That's fine. And
I
what
cannot
about
tell
now?
what it
No
is
worries.
now.
What about now? Yeah.
Yeah, now, so I'm pretty good now, so I can do, as I say, get in bed mobility,
All right.
getting in and out of bed pretty, I don't need my husband anymore to help me, and I can stand up,
All right.
so,
Put on your feet up.
yeah, Yeah,
All right.
that's okay. I can
And
do that. He doesn't need to give me a push anymore
all
or
right.
something like that.
And are
And
you
I can walk about 200 meters,
pretty
maybe
cool?
something like that outside.
Are you
Mm.
using
But I'm
any
getting
cane?
really no,
Not cane, no
no, no,
frames or stuff like that?
no,
No.
no, no. They don't
Great,
give me
beautiful.
anything. And yeah, 200 meters. But I get tired,
Really tired. Like
Yeah.
your legs are tired, or you feel like your breath is taking.
No, the legs,
It's not
it's
more
the
the legs.
legs.
All
Yeah,
right.
yeah, yeah. Though
Fair
the
enough.
arm was worse, in the beginning, but it's the leg which is really
Not a
a bit,
problem.
bit
So,
tiring right
in
now.
terms of your left upper limb, your arm, your shoulder, how is it now? Is it painful, or you think it's alright?
Uh, yeah, I think, yeah. I still
You can lift that up properly,
properly
and are
because then
you
it gets painful,
all right? And are you
so
using a sling
the
at the
OT
moment?
gave me a sling, but
All right.
I'm not trying not to use it as much anymore. I mean, it's been 7 years
Because you
ago.
don't want to, or you wanted to just get rid of it, and
When
you
it's
feel
getting
like
when
it.
the pain is getting really bad, so then I use the
All right.
sling because I can move it a little bit. It's
All right.
not like
It's not completely gone.
it's
Yeah.
not yeah.
But
Right.
sometimes it's painful. So,
Sometimes, and then I use the sling.
all right, I will, because this is my first time with you, and I want to, give you the best out of the health team. I would like to engage you with the OT again, so she can have a look after 7 years how your shoulder is, if there is anything that he could do, the OT could do in terms of not feeling pain and maybe improve a little bit your mobility and stuff like that. Well, that's something that you could
Yeah, might be
consider.
a good refresher.
Yeah, for sure.
Might be good.
And in terms of your swallowing and your speech, are you having experiencing choking
it's
or
not.
problems
No.
eating or swallowing stuff like that? And what about articulating your voice? Is everything alright on that end? Or are you still
Well,
struggling
my
a bit?
husband says so.
Alright, that's fair enough. So you don't find
You know?
yourself struggling with articulating your words or swallowing
No.
or getting choked?
No, it's not too bad. No.
It's not too bad, meaning that it's still happening, or
No, no, no.
doesn't
It's
happen?
not. It's not happening.
All
It's
right,
not
so
happening.
that's all right. I was asking this because if it could happen or it start happening again, that you find like your words are not coming out easily, or you are struggling articulating your words, or have problems swallowing, or all of every now and then you get choked, or have problems with with the food. Maybe you can have a consultation with a speech pathologist to again refresh and reassess everything, how everything is going in that
Okay.
area. All right.
Yeah. All right.
All right. Cool. So we are going to focus now on your lower limbs in this session with the physio. So you told me that you are able to basically do everything by yourself, but you get tired easily.
Tired. That's
really
the main
easily.
problem.
If
Yes.
if you would be able to put a number between 0, which is not tiredness at all, not fatigue, and 10, which is the maximum fatigue that you could ever imagine, how would you rate after this 200 meters?
Yes, 6,
7 or 6.
7,
All right,
6,
fair
7.
enough.
Yeah,
And
where I think.
what sort of stuff do you do to get rid of or alleviate this fatigue? Just having a rest, or
Rest. Just
cool.
rest.
And how long does it take for you to get back to be able to walk again?
10 minutes, 20
10
minutes,
minutes.
something like that.
All
Yeah.
right, that's okay. So Brianna, not using any assistive device, that's great. Pain in any side of your body?
Just sometimes. Right now.
Yeah.
No, not too. No.
No.
No, I'm
No lower
alright.
pain, no leg pain, cramps
No.
or stuff like that.
No.
Okay. And what about um, any sensation impairment like pins and needles or stuff
No, I don't
like
have
that?
that. No.
Okay. So you feel probably the left side, your left leg is weaker than the right side.
Yeah.
All right. So no numbness or tingling on that leg, or
No, it's
no?
just weak. It just
It
feels
just
weak.
feels weak.
It just feels weak. And maybe, I don't know, sometimes maybe I feel, it's not 100% there,
All
maybe
right.
it's like a bit, but it's not pins and needles or something like that. It's like walking on a cloud,
All right. Numb.
feeling, numb,
Feels numb.
yeah, maybe numb,
Okay.
numb.
Have you ever seen your knee buckling or giving way, or feel like your knee is giving way?
Yeah, in the beginning when I started, with the physio, so
Yeah, but what
yeah,
about now?
alright. I think it's okay.
It's alright.
I
Alright, we
don't
will.
feel like it's buckling. I'm not sure whether I'm doing it right.
Alright,
So
not a problem. So I think that I got a picture of what it's going on now and how are you overall mobility. So I would like to get back to your overall health status. So do you have any other medical conditions apart from this stroke that I should be aware of?
schizophrenia.
Alright. Do you take any meds
No,
apart?
no.
Alright. Do you smoke?
No.
And do you drink alcohol?
Yes, I do.
Alright. How often and how much would you say it is?
Twice a week.
Twice a week.
3 times a week.
You drink alcohol? Okay. And how much?
Oh, 1 pint, 2 pints.
Alright. Alright. So do you think or would you consider lowering down a little bit the intake?
Doctor said something.
Yeah, probably yes, because that's something that will be advised for you, for your, for your benefit in terms of um, reducing or reducing alcohol intake will help you to get a better overall health. You know what I mean?
Yeah, I know. But what joy.
I know. It's not easy, but if you consider having just to give it a try on that, there is a lot of support out there that we can engage you to. So if you're happy with it and maybe you can consider, just think about it. Maybe I can come up with some information for you to, engage you and put you in contact with support teams that could give you some ideas of how to address this. Will be all right for you?
No.
No, you don't like it? That's
Yeah,
fine.
no, it's okay. Yeah, of course.
All right.
Yes,
So
of
it's
course.
something that you will consider to do.
Yeah.
Okay.
Yeah,
Fair
yeah,
enough.
yeah.
So that's
Well,
great.
talk to my husband as well.
For
He's
sure.
gonna have his,
Okay.
beers
No.
at night. It's
Sure.
unfair. I can't have it.
All right. No, it's not the fact that you can't have it. It's more the fact that we need to get at the point to reducing as much as we can.
Why?
Because it's really important for the
Only
overall
twice or
health.
3 times a week.
Sorry?
It's only twice or 3 times a week.
I mean, yeah. I mean, it's not that you are drinking a lot, but I tell you, the best thing for every person is not drinking alcohol. So if you're taking 3, maybe you can come down to 2 a week, and yeah, work on that.
I will think about this.
For sure. That's enough for me. Maybe we can talk later in the future
That's
session.
it. Yeah.
All right. So, social wise, do you live in a single story house, double story house?
No, I have. I think we have stairs.
Single story or double story
A
house?
double story, I think.
All right.
Yep.
Do you have steps, ladders
Yes,
to
we
get
have
to the
steps.
second floor?
Yeah.
All right. How many steps do you say it is?
It's not like 10.
10 to get to
yeah,
the second
to
floor.
Go to second floor.
And
yeah.
what about to get in and out of your house?
Just a normal.
Flat.
No. Just a normal 3 steps.
3 steps in the front.
I can't do that by myself though, so
All
my
right.
husband has to help me there.
Do you have rails there?
Mm-mm.
And did the OT assess your home?
No, hasn't.
All right, that's also something that we need to address to see if it's the rails are needed for you.
I don't know why it never happened, hey? So that would be of great help because the
For
stairs,
sure.
My husband has to help me.
Help you to manage the stairs.
Yeah.
And what about the second floor? How do you get to the second floor?
With my husband, and I hold on, So,
to him?
he's
He
not
holds.
any. Yeah, and we've got the rails. Let me think. We've got the rail on the right side.
All right.
Yeah.
All
So
right.
I can hold on to the
right.
rail. Like a stair. I don't have a rail on the wall.
All right.
You know.
But what about you are going down?
Yeah,
Because you are,
that's always a bit of a,
that's the problem, yeah,
that's a bit of a problem because my left arm is not working
for
properly.
sure.
I cannot really.
Handles or something. So yeah, for sure, it's something that we need to address like really early if you want to go to the second floor by yourself or with any sort of
Would be
assistance.
good.
I will highly recommend you to try to stay on the first floor before we get the OT.
Yeah. It's been
Assess your house
yeah, it's been
in
7
terms of
years.
your
It would be
security.
at some stage I would like to go back up again. I've got my
Okay.
sewing
But
machine up
this
there.
this this these days you manage yourself in the first floor, just the
Yeah,
first floor. Is your room in the first floor now?
yeah, yeah. It's
Bathroom
still
as
in the
well?
yes, it's still in the first floor because
Okay,
I'm
so
still.
I'm still I strongly recommend you don't go into the second floor until you get the two rails and the the proper
Yeah,
assessment of the OT. All
yeah,
right.
yeah.
And certainly this is something that we're gonna keep in mind to work on the future sessions so you're gonna be able to um, address, manage or navigate those stairs without the needing of much assistance.
Yeah.
All right.
Okay.
Okay. So you live with your husband. Somebody else lives in your house.
Mm.
Just both of you, and
We don't have children.
is he supportive with you? Like, is he able to help you?
Yeah, he's
Supportive?
retired. Yes, he's retired and he's quite supportive.
All right. So he drives you back and forth from
He
your
does all
appointment
that
and
for
stuff.
me. Yes, he's a good
All right.
husband.
Do you find yourself struggling with any daily life activities like getting dressed or showering or toiletries?
No, that's all good.
It's all good.
So I can reach my
Your bag
my
and stuff,
back. Yeah,
and you can
yeah.
do your
And
toiletries by yourself.
yes, sometimes I learned how to put on the clothes on the left arm first.
For sure.
And
Beautiful.
no, I'll be okay.
All right.
I'm okay. He doesn't have to help me as much. Or as
Beautiful.
much.
So, few questions just to rule out a few things that will require further assessment. All right. So, any headaches, like unremitting headaches or the worst headaches that you have experienced?
No, I'm okay.
Any problems with your vision or your sight?
Yeah, sometimes I think my left side is not really
working.
Yeah,
but
not
that
really
happens
working as much.
sometimes.
No, I think that has been since I had the stroke.
Alright.
It's always been a bit impaired.
So the left side of your vision is your visual
Everything
field
on the
is
left.
gone.
Yes, I
Is
think.
gone,
Yeah,
alright.
yeah, not.
What about the hearing? Any
No
problems
problem.
with hearing?
Problem.
Taste?
All good.
All good. You already told me swallowing was not a problem.
No.
What about chest pain or cough? Any fever or chills? Night sweats? Any new or sudden onset of any weakness or sensation impairment?
No.
Not new after the stroke?
No.
Anything new?
No.
Alright, any problems with your bowel or bladder bladder? No? Any problems, pins and needles?
No.
Any sensation impairment apart from the one that the stroke gave you? No?
No.
No, and not problems with nausea or dizziness or okay. Anything else
It's basically my arm,
that is sore?
Arm, leg, and
Alright, but you're not in pain now on your elbow, do you?
No, it's
Alright.
1
Fair
out of
enough.
10 or something.
For sure. So, what would it be that you want to achieve for today's session, Rihanna?
Maybe as a little bit of a refresher.
Alright.
So what I can do.
What sort of stuff are you able to do?
Yeah.
Alright.
So what I can do, I would like to get into the swing again to get more maybe exercises.
Okay.
You get a bit stale after a while.
For sure.
So.
And what brought you here after all these years?
Yeah, I noticed. I want to go to the wedding of my daughter.
Alright.
I want to. In times of equality.
Alright.
I want to walk her down the aisle.
Alright.
And that's in 6 months.
That's in 6 months time.
And I think because I haven't practiced as much, and so.
You haven't experienced any falls in the last time?
I had falls.
Alright. So would you mind telling me about it a little bit?
Yeah, I
Wow.
tripped, I lost balance, I turned around, lost balance,
And how often has it happened?
I think I had two falls, what I can remember, two falls in the last 2 months.
All right, two falls in the last
Mm.
2 months. And what happened in those occasions? Like you just trip over? Did
I
you
lost
cut?
balance, yeah, yeah,
Did you
yeah.
cut your feet on the ground? Was caught
Yes,
like?
yeah,
All
yeah,
right.
yeah. I've got, so a bit of a,
Was your foot like
foot, yeah,
a
it's
little bit
dropping a little
dropping
bit,
on it, and did you get
yeah, and then I
caught, and
got,
then
yes, that's
you
it,
drop? Yeah.
lost balance and I tripped,
All
so
right. It
got
didn't
stuck.
happen when you were turning.
Uh, yeah,
When you
yeah.
were
One
turning.
one was when I was walking, and one was when I, oh, I kind of when I turned, and then my foot didn't
All right.
really,
Didn't follow the leg. All right.
Yeah, yeah.
All right. Fair enough. But no knee buckling. No, wasn't because of the
No, it was
weakness. Of,
no, it was not knee
did you hit
buckling.
your head back in one of those
On the
occasions?
first one I did, yes.
All right. And
A
did
little
you lose
bit
your
of bump.
consciousness, or did you
No,
have to go to the ED or something?
no,
Did
it
you get
was
up by
okay.
yourself, or did you need any
I
help?
did. I managed to get up by myself.
Mm-hmm.
My head was a bit sore after, right?
For sure.
Yeah.
But you got
But
up by yourself.
I got, yes, because I was alone
All
in
right.
home,
All
so
right.
my husband was shopping
All
at
right.
the time.
Any problems after that? Like I don't know, any apart from the bruises, probably. Did you have any problems walking, or was just the fall?
No, just normal. Yeah, I was a bit scared,
For sure.
so
And what
falls
about
are
now?
scary. I didn't break anything,
Yeah.
thank God.
And what about now? Are you still a bit scared of falling
Yeah,
again?
yeah, because I'm, it's a weakness which makes me think, oh God, don't fall.
Sure.
God,
And
like, and
within your house, do you walk by yourself, holding onto the furniture, or do you just walk just
yeah,
without any problems at all?
I do furniture walking. Yeah,
Furniture
I
walking.
don't have a walking aids.
No worries. We will certainly address that now, and we are going to have a proper look of all your, over your overall mobility. Okay?
Yeah.
Okay. Great. So now comes the second part. I will do my hands-on assessment. All right?
Mhm.
So you told me that your vision field is a little bit impaired, so probably the left side is a little bit blurred or not there. It's gone. So would you mind telling me when you see my your on your right my right finger?
No.
All right.
Yes.
What about the left?
Yeah.
Yeah, gone. So this is your visual field. All right.
Mm.
Can you follow my finger? Put your eyes on my finger, and without moving your head, try to follow my finger. Beautiful. Down and up. Good job. Now keep your eyes on my finger and move your head to the left and to the right, and up and down. Good. Beautiful. Did you hear this?
Mhm.
Does it feel the same?
Mhm.
Okay. Can you close your eyes for me, please? Do you feel this?
Mhm.
Feels the same in both sides? Probably less on this side.
This one is a bit less, yeah.
It's a bit numb. What about here?
Same.
Same? Alright. Does it hurt here?
When you press
Your
too
shoulder?
hard, yeah.
Does it hurt? You are not with your sling, do you? No.
No.
Alright. Can you please do chicken wings for me, please? Open your eyes and do chicken wings for me. Alright. Great. Let me push it down. Good job. Open your eyes. Great. Now, press my hands. Press my hands as hard as you can. Alright. Push my hands now. Push my hands. Push, 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 push. Good job. Squeeze my hands. Alright. Close your eyes for me, please. Let me know if your thumb is up or down.
Up. Down.
Keep going. Up or down.
Up. Down. Up. Up.
Alright. Not too bad. Keep your eyes closed and let me know if do you feel this? Does it feel the same or this side is a little bit less?
This one is a bit less, I think.
A bit less. Here? Same? Alright, what about the soles? Do you feel the soles?
Same like, yeah.
Feels numb or really numb?
No, it's just
you
less.
Still feel
I can still feel it, right?
Okay, easy. So, keep your eyes closed and let me know if your toe is up or down. Up or down?
Up, down, up, down.
Cool. Same with the, sorry, I broke your toe.
Up, down, up, down.
Cool. Beautiful. Open your eyes, please. Can you scoot backwards a little bit so you're sitting a little bit better there? Can you raise your knee up toward the ceiling for me, please? Keep it down. Don't let me push you down. Don't let me push you down. Good job. Kick out the leg for me, please. Don't let me push you down. Beautiful. Toes up. Don't let me push you down. Don't let me push you down. Good job. Press my hand. Good job. Same with the left. Knee up toward the ceiling. Don't let me push you down. Beautiful. Up. Press my hand. Good job. Kick out the leg for me, please. And don't let me push you down. Don't let me push you down. Up. Up. Don't let me push you down. Good job. Up. Toes up for you. Don't let me push you. Don't let me push you. Good job. And now press my hand. Alright. Overall pretty good. Pretty good. Little bit weaker on this side, but nothing too bad. Alright? Now I want to have a look how do you stand up from the chair. So please stand up for me. Go. Are you sure you want to stand like that? Not the other side?
Oh, okay.
Yeah?
Alright, yeah, I didn't realize.
Yeah, probably. It's the other way. Go back. Go back to the chair. Alright, so this is the stronger side.
Yeah.
Is it?
Yeah.
Alright, so would you mind standing up for me again, please? Yeah. That seems to be better. Alright. Probably the other side.
No, I'm supposed to lean to the left side and get out wrong. Anyway.
Because you are not showing any pusher syndrome on while you were sitting, so I was not expecting that.
Yeah, I just follow the prompts. To support of your husband, citizen can do independent but show incorrect technique with increased lean to your left.
Yeah, that's fine. That's pretty cool. That's alright. No worries. Because you were not sitting like that, so I was not expecting pusher syndrome. Alright, but that's fine. So stand up again for me, please. I will let you know that later.
Yeah.
Up again for me, please. Alright. Fair enough. So, as you can see, Brianna, I'm sitting here next to you. You're putting lots of weight on your left and your right, which is great. But you tend to lean on your left. Alright? That's because probably your right side is affected. So, you are just recognizing this side of your body. And you are kind of forgetting that you have also a left side. So I want you to be focused on trying to be in the middle rather than leaning on the left. Does it make sense for you? Alright, cool. So I want you to start doing some weight shifting. Try to do some weight shifting there. Alright, I'm gonna release my hands and I want you to start doing that. And I'm going to hold very close to you. You're not gonna fall, reassured. Alright, cool. So stay in that position and I'm gonna time how long does it take for you to keep that position, you know? Alright, so hands to the side and try to keep that position. Let's say it was 30 seconds. Alright? Cool. Easy. Now put your feet together for me, please. Feet together and keep that position. Wow, pretty good. Pretty good. All right, 30 seconds. Enough. Step ahead. Left left foot ahead, please. Yeah. And keep that position as well. Pretty good. Pretty good actually. Alright, 30 seconds. Go back. And then the left, sorry, the right. Go ahead.
Yeah, that's...
Feels weak.
It feels weak, yes.
Feels weak, yeah. But at least it's not buckling, so that's alright.
No.
You're still really strong there. Alright, go back. Go back. Now I want you to put your left feet right in front of the right. Yeah. Yep. And keep that position. How long it takes for you to? Alright. 20 seconds. Beautiful. The right one are doing pretty well. I don't need to make it longer so because you're pretty stable in this position. Alright. Now let me take how long does it takes for you to keep this position. Alright? 1, 2, 3. Alright, 3 seconds. Easy. Alright, how do you feel? Bit tired?
It's okay.
Alright. Sore legs?
No,
Fatigue legs?
yeah, this
Alright.
starts a little bit now with this.
Alright,
Standing on one leg and
what number
that,
would you say it is?
From 0 to 10? 5.
Ah, 5.
5, 4, 5.
We can do that. Alright. So give me your hands please and rise your left knee up toward the ceiling and keep that position. 1, 2, 3, 5, 6, 7, 8, 9, 10. Beautiful. The other one. 1, 2, 3, 4, 5. Beautiful.
Oh, yeah.
9, 10. You're doing so well. You're doing so well. Alright.
We do that again.
Let's say it's just 15 seconds. That's okay. 15 seconds. Cool. So, steps to the left side for me, please. Keep going. 3 steps to the left.
Oh, yeah, okay.
2, 3, and then 3 steps to the right. 1, 2, 3. Good job. Now, I'm going to put this chair, and I just want to do a 10-meter walk test, just to have a proper look of your gait, and yeah, how long does it take for you to go to the 10 meters? All right. All right. So you will see here a mark on the floor, and you will see the other mark 10 meters there. So when I say go, you're gonna stand up from there. You're gonna start walking, and I'm gonna start my watch when you pass through this mark, and I'm gonna stop my watch on the 10 meters, but I need you to keep walking. All right?
Okay.
Keep walking.
Yeah.
All right? Don't stop on the 10 meters. Make sense for you? All right. So this is what's gonna happen. I'm gonna stand on your left side in case you lose your balance towards the left. I'm not gonna touch you, but I'm gonna be just on your side, just to make sure you are not gonna fall.
Okay.
All right? So 1, 2, 3, go. 2, 3, 4, 6, 7, 8. Come back. 10. Beautiful. All right. There is a few things that I caught on this test. It took you 20 seconds to get to the other side. First thing first. No, you're not gonna sit down. Are you feeling tired?
No.
Okay. So what are we gonna do now is come with me. So basically, what I'm seeing here is that you are dragging your left feet. All right, so that's probably one of the causes of you falling over. All right, so we are going to start breaking down the gait, um, the gait stages. All right, so what I mean by that is that I want to start practicing just knee flexion 10 times. Knee flexion, knee flexion, knee flexion. 10 times. Sorry, yeah, hip, you're right. Sorry about that. Hip flexion, hip flexion, hip flexion. 10 times. All right?
Now?
Now, straight away. 1, 2, and 3. And remember, when you are doing this, try to keep your feet up, pointing up.
Work. Yeah.
All right?
Okay.
All right, go for it. 1, 2, 3, 4. Feet up. 5, 6, 7, 8, 9, 10. Beautiful. All right.
Okay.
Now I want you to do some heel raises.
Oh, okay.
10 for me, please.
Alright.
1, 2, 3, 4, 5, 6, 7. It's been a long day, sorry. This is my last patient of the, of the day.
I got up by
And
4 o'clock.
10. Alright, how are your legs? Feeling like you need a rest? Alright, have a seat please. Remember, every time that you are having a seat, go back as far as you can. When you feel the chair is behind your knees, then it's sure for you, it's safe for you to have a seat. Alright. So I bet it is really, really fatigue for you. You are feeling, a lot of fatigue.
Yes.
So let's use this time to do some of educations. All right. So what I want you to do at home is that you start making aware yourself of. First thing is pointing your toes up. Every time that you're walking, try to keep your feet up. Feet up. Your toes up. Toes up.
I saw something on, don't know, one of these things which hold the foot up. What do you think of that?
Well, it's not a bad idea. It's all about the occupational therapists that could be assessing that in terms of.
So you physios don't do that?
We don't do that straight away because this is the first time that I'm seeing you. So I would like to give it a shot, to give it a try to exercise first.
Yeah. Okay.
All right. Because if we put any orthosis there, your muscles is gonna get weaker, and you're gonna lose the muscles, and we don't want that. We want to try first muscle training, strengthening.
Okay.
All right.
Yeah.
And if it doesn't work, and you're falling again and again, and it starts to be really interfering in your daily life activities and your safety, we can consider that in the future sessions.
Okay.
All right.
Okay.
But now I would like to try exercises. How does it sound to you?
Yeah. Good.
Sound all right?
Yeah. That's why I'm
Beautiful.
here for. Okay.
All right. Stand up for me, please. Again. All right. Remember, look yourself, feel your body. You are leaning toward the left. Remember, try to keep yourself on the middle. All right? All right. That's the first thing. So, you remember the exercises that I gave you just now? Hip flexion with the toes up.
Yeah.
And the second one, heel raises.
Yeah.
That's 2 exercises that I want you to do at home.
Okay.
All right. And the third exercise that I want you to do at home is this. You're going to use a chair on your right side. Sorry. Oh. I already smashed your good arm. Sorry for that. Did I hit you right there?
Yeah, funny bone. Yeah.
Oh, sorry for that. All right.
Okay.
So,
next one.
the third one, you are going to hold onto that chair,
Yeah.
and I want you to start doing this movement. So, hip flexion and land on the knee, on the heel, and go back. Yep, and land on the, remember to land on your heel and come back. Land on the knee and come back. Right?
On the knee.
Sorry, it's just my brain is so tired.
Yeah.
Land on your heel and then come back.
Okay.
Land on your heel and then come back 10 times.
Mm-hmm.
Alright? These three exercises,
you can write this down
for sure.
me, yeah?
I'm gonna write them down for you, but I want you to do these three exercises 10 times each, 2 sets of 10 times.
Okay.
And at least 2 times a day.
Okay.
Alright?
Mornings
So,
and
2
afternoons.
sets of 10 each, at least 2 times a day.
Alright, so
Makes
this
sense?
one,
Yeah, heel rises,
this one,
and
this
then
one.
landing on the heel.
Okay.
Alright? Back and forth.
Alright.
Back and forth.
Okay.
Okay?
Yeah.
Alright, now, let's go for a short walk and see how it goes with the new improvements that, the new.
I will try.
Yeah, you
I will
go.
try.
I want you to try.
Mm-hmm.
I know this is not magic, it's gonna come with the, with time, but let's see how it goes for you, alright?
Okay.
Let's go for a walk. I'm gonna be just next to you. Alright. Much better. Now you can turn over. How are you feeling?
Yes, I
Bit better?
practice. Yeah.
Yeah, for sure. Alright. Come back and have a seat here. Alright, how do you feel? With fatigue
Thank
or
you.
better?
Better.
Are you feeling better?
I feel better now.
Cool.
I've got hope. I want to,
For sure.
in 6 months I'm really,
You want to achieve that, and
my daughter,
that's a goal that we are going to keep in mind, for sure.
That's
Alright,
very good.
so I see you're not too fatigued, so I want to take you for another walk and try some steps, just the first trial, as a first trial. In future sessions we are going to work a little bit more on the stairs.
Okay.
Alright?
Mm-hmm.
For now I just want to make sure you can go up and down on one step.
Yeah.
Alright, and see how do you do that.
Yeah.
Okay? Alright.
Okay.
Let's go to the step. Alright, here you got the steps, and I just want to start strengthening your left foot. Alright? So, with your left foot, you're gonna step up, and your right one is gonna follow. One, and then with the right one you're gonna go down. Now this is just strengthening.
Okay.
Alright?
Okay.
Alright. 1 and go down. 2. 1 and 2. I'm gonna do this 10 times. 1 and 2. Yeah, you're gonna feel like you're working on your leg, which is great. 2, 1, 2, and the last one, 1 and 2. Alright? The first thing that I want to let you know is each time that you are turning, try to turn toward your right side. Alright? If you have to turn over, turn toward your right side, so you don't take the risk of your feet getting caught when you're turning left.
Okay.
Alright?
Yeah.
Remember, always if you need to turn around, go toward your right. Alright? And your left feet is gonna follow.
Okay. Yeah.
And you are going to lift your foot up out of the floor. The main thing that we need to work on is trying to keep your feet up.
Okay.
Alright?
Yeah.
That's the first thing, and I want you to practice this at home. Every time that you are walking, try to keep your feet up,
Okay.
working on that. We're trying to start strengthening and making that leg aware of trying to keep the feet up.
Okay.
All right. So have a seat, please. We're
Must be
going
over
to.
an hour, hey? How much is it?
What was that? Sorry.
What's the time?
45.
45.
Yeah.
Oh.
So the last test that we are going to retest now. Redo the same test that we do, for the first time, the 10-meter walk test. You already know how to do it. So when I say go, you're gonna stand up, and I'm going to take the time. All right?
Okay.
1, 2, 3, go. Remember what we have practiced today.
Yeah.
Go.
I might stay in the middle. And then.
Bits. Remember, I'm just next to you, just in case. The first time it took us 15 seconds, and now it's 13 seconds. Good job. Go back to the chair.
Longer, I think, doesn't it?
Or 20 seconds, and now it's 18 seconds. Wow. Doesn't matter.
Oh, I feel much better now.
All right.
Perfect.
How do you think? Do you feel now?
I feel positive.
All right. Less afraid of moving, probably. Less afraid.
Now
Less
that I
fear.
know what to do, with.
All right. So that's the first thing that I want you to take home with you. Keep your feet up. All right. Toes up. Toes up. Toes up. Remember.
Okay.
If you are turning around, turn toward your right.
Okay.
Okay?
Yeah.
And I'm going to write down all the exercises for you.
Okay.
I want you to do 10 times, 2 sets of 10 times, at least 2 times a day.
Okay.
Alright?
And always turn to my right. Yeah, that is very helpful.
Any questions that you got for me now?
No. When can I see you again?
Yes, today is Tuesday. I want to see you again on Friday to see how are you doing with the exercises and see what are we going to do on the weekend.
Okay.
Alright?
Cool.
All good to you? Sure.
Thank you. All right.
Right. That was 40.